Dear brothers, I want to share with you a true story about one of my patients. Mr. Alex, 65 years old, used to be very healthy. He walked every day, played Chinese chess with his friends, and had a clear and alert mind. However, about 6 months ago, he began waking up multiple times during the night to urinate. At first, he thought it was just a part of aging and didn't pay much attention to it. He even joked with his wife, saying, "Maybe I just drank too much tea." But as time went on, the problem didn't get better. It got worse. He told me that some nights he could barely sleep at all, constantly getting up to go to the bathroom. He became exhausted, with dark circles under his eyes, and lost his appetite. Still, he tried to endure it, telling himself that he'd get used to it and it would eventually pass. Then one evening, while sitting with his friends, Mr. Alex suddenly felt a sharp pressure in his lower abdomen. He desperately needed to urinate, but couldn't. The pain was so intense that he passed out on the spot and was rushed to the emergency room. That was when we discovered he had acute urinary retention caused by an enlarged prostate. I'm not telling this story to scare you, but to remind you that some symptoms appear very quietly, sneaking into our daily lives. It's easy to ignore them and assume they're normal. But in reality, they could be warning signals from your body, especially after the age of 60. The prostate is actually a tiny gland located just below the bladder, surrounding the upper part of the urethra. Normally, it doesn't draw much attention. But as we age, especially after the age of 60, it tends to enlarge, pressing against the urethra. And the result? Something as simple as urination can turn into a real nightmare. What's concerning is that most early symptoms are very subtle. We often think it's just a normal part of getting older, but in reality, these are warning signs. If we ignore them and let the condition progress, the consequences can go far beyond just inconvenience. They can lead to more serious and dangerous complications. I often tell my patients, if your body is sending you a signal, don't ignore it, because every signal is a reminder that it's time to pay attention. Brothers, think back for a moment. Have you ever found yourself in a situation like this? You're fast asleep in the middle of the night, but suddenly have to jump out of bed to go to the bathroom. And not just once, but 3 or 4 times a night. At first, you might think it's just because you drank too much water before bed. But over time, it becomes a habit that disrupts your sleep, leaving you exhausted in the morning. Or maybe you've stood at the urinal, waiting and waiting, only to have a weak, interrupted stream. And even after you're done, it still feels incomplete. Some guys carry around a constant worry that as soon as they leave the house, they'll need to turn right back around because they need to pee again. These little things we often brush off, are actually warning signs of an enlarged prostate. I've heard many patients confide in me. "Doctor, I feel embarrassed to talk about this. It's hard to bring up, and I figured everyone goes through it, so I just ignored it." But that very embarrassment is what causes many men to discover the condition too late, living with constant discomfort, or even facing complications. If you're watching this video, I want to ask you honestly, have you ever experienced symptoms like these? Frequent nighttime urination? A weak stream? That constant urge to pee? If so, please share your story in the comments. Who knows, your experience might help someone else realize it's time to get checked. Consequences of ignoring it. Dear brothers, in medicine there's a saying I strongly believe. Disease is not the scary thing. What's scary is neglect. With prostate enlargement, the danger doesn't lie in the early symptoms, nighttime urination, difficulty peeing, weak urine stream, but in how we ignore or dismiss them. It's that very indifference that has led many patients into advanced stages, paying with their health, sometimes even their lives. 1. A wake-up story. Mr. Bean and the price of negligence. I remember clearly a patient named Bean, 68 years old, a carpenter by trade. For many years, he was healthy, hardworking, the pillar of his family. But about 2 years ago, he began to have trouble peeing. At first, it was only a weak stream. Then came the feeling of not completely emptying his bladder, always a lingering pressure down there. His wife repeatedly urged him to get checked, but he brushed it off. "It's nothing serious. I'm getting old, so things slow down." One evening, after dinner and a few drinks, he felt a severe urge to urinate but stood there unable to. Pain in his lower abdomen spread to his back, beads of cold sweat formed. His family rushed him to the hospital. By admission, his bladder was rigid and distended, over 1 liter of urine trapped. We had to insert a catheter immediately to relieve him. Further tests revealed his kidneys had begun to lose function due to the prolonged blockage. From that point on, his life changed completely. He could no longer work as before, had to be hospitalized frequently for monitoring, and medical costs kept rising. All of this started just because he ignored the small warning signals his body was sending. You see, brothers, a little negligence, a little embarrassment made Mr. Bean pay with much more than discomfort. It cost him a large piece of his life. 2. Dangerous complications from ignoring prostate enlargement. To help you understand clearly, here are the complications we often see in patients who come in late, supported by medical data. A. Acute urinary retention, the nightmare at night. This is a scenario I encounter often. Patients describe a terrible urge to pee with a full lower abdomen, yet no relief. The pain escalates, some sweat, face turns pale, some even pass out. Acute urinary retention is like trying to flush a toilet when the drain is completely blocked. Urine builds up, pressure rises, the bladder swells. If untreated, it risks rupture. Aquablation US. +2. Cleveland Clinic. +2. B. Bladder stones, the result of stagnant flow. When urine doesn't fully exit the bladder, sediments accumulate and form stones. These stones scrape the bladder lining, cause pain, blood in urine, even blockages. I have removed stones almost as big as eggs in surgery. Just because of long ignored, I didn't empty fully. Mayo Clinic. +2. Aquablation US. +2. C. Repeated urinary tract infections. Stagnant urine is a perfect breeding ground for bacteria. Many patients get recurring infections of the bladder or even kidney pelvis, frequent UTIs, high fevers, body weakened, sometimes dangerous spread of infection in a bloodstream. Cleveland Clinic. +2. Aquablation US. +2. D. Kidney damage, the heartbreaking outcome. The kidneys are the body's filters. Prolonged urinary obstruction causes back pressure, which over time damages kidney function. Initially mild dilation, but gradually the ability to filter blood declines. I've seen many patients end up on lifelong dialysis just because prostate enlargement was neglected. Dr. Austin Slade. +2. Cleveland Clinic. +2. E. Masking prostate cancer. Even more worrying is that enlargement of the prostate may hide early signs of prostate cancer. Some patients come when the tumor has spread, when treatment is much harder, prognosis much worse. If caught early, chances of survival are much higher. Cleveland Clinic +1. 3. Impact on quality of life. Don't think the consequences stop at physical health. They hit mental health and family happiness hard. Sleeplessness day after day. Waking 4 or 5 times a night to pee. Tired in the morning. Lack of concentration. Memory suffers. Loss of confidence. Some men avoid going far, fearing they won't be able to hold it. At weddings, meetings, always rushing to the restroom. Effect on marital relationship. Prostate enlargement can cause erectile dysfunction, reduce desire. Many elderly men tell me they feel they've lost their manhood, feel ashamed, distant from their wife. Financial burden. When disease advances, costs of drugs, surgery, hospital stays rise, becoming a heavy weight on the family. One patient said in tears, "Doctor, I am not afraid of dying, only afraid of becoming a burden to my children." That is a worry many face after age 60. 4. Lessons from reality. Every case I've seen leaves me a lesson. The common lesson is, if you just listen to your body, get checked early, things are far simpler. Mr. Bean, the carpenter, because of negligence, tied his life to hospitals. Mr. Alex thought it was just insomnia due to old age, ended up in emergency. But there are people like Mr. Ben, encouraged by family to get checked early, now healthy, joyful among loved ones. If you're hearing me now, I want to ask, have you ever had nights where you had to get up 3 or 4 times to pee? If so, don't dismiss it. That could be the alarm. If you've ever felt embarrassed, kept quiet, endured in silence, I hope that after watching this video, you'll see things differently. Don't wait until an emergency, until you regret. If only I had gone for a check earlier. Advice and solutions. Dear brothers, after hearing the stories I've shared, some of you may be wondering, am I experiencing these symptoms too? And if so, is it too late to make a change? Let me assure you, it's never too late to start caring about your health. Let me tell you a positive story. This is about Mr. Rober, 62 years old, a kind farmer who's lived his whole life in the countryside. Mr. Rober never really paid much attention to illness. He spent his days in the fields, came home at night for dinner, and enjoyed a few drinks with friends. But recently, he started having trouble urinating, sometimes standing at the urinal for a full minute before anything came out. At first, he thought, I'm just getting older. Everything's slowing down. One day, while visiting his son in the city, his son insisted on taking him for a checkup. The results showed early-stage prostate enlargement, but thankfully, it was caught early. With just some supportive medication and a few lifestyle changes, Mr. Rober saw big improvements. He started sleeping better at night, waking up less often to urinate, and he felt noticeably more cheerful. Mr. Rober's story gave me real hope. If caught early and addressed in time, we can absolutely live a healthy and joyful life, regardless of age. And that's what I want to share with you today. This isn't just about disease. It's about how we live and how we learn to love ourselves as we grow older. 1. Don't skip regular checkups. The first and most important thing, get checked. I know many of you are hesitant. You don't like hospitals or think I can still get around, so I'm fine. But the truth is, silent conditions like prostate enlargement can only be clearly diagnosed through exams and tests. When you visit the doctor, you'll undergo simple procedures, an ultrasound, PSA blood test, or a rectal exam if needed. It may sound intimidating, but it's quick and safe. More importantly, it helps you clearly understand your condition and take the right steps early. I've seen too many patients who only come in when they're already in acute urinary retention or dealing with complications. At that point, treatment becomes more complex and expensive. So if you notice anything unusual, make getting checked a top priority. 2. Change your habits, the key to living well. Besides seeing the doctor, daily habits play a huge role. And this isn't just theory. I've seen many patients make real progress from small, consistent changes. Limit alcohol, coffee, and smoking. These irritate the bladder and worsen symptoms like nighttime urination and urgency. I know these habits are hard to break, but think about better sleep, healthier kidneys, and being around longer for your loved ones. It's worth it. Avoid drinking too much at night. Drinking tea, water, or beer late in the evening fills up the bladder and causes frequent nighttime urination. Try to stay hydrated during the day and reduce liquid intake after 7 p.m. Maintain a healthy weight. Obesity increases the risk and severity of prostate enlargement. A diet rich in vegetables, whole grains, and low in red meat and animal fats will help significantly. Stay active. You don't need intense workouts. A 30-minute walk daily, light stretching, or Kegel exercises for the pelvic floor can boost circulation and ease bladder pressure. 3. Kegel exercises, a hidden secret for men. Most people think Kegels are only for women post-pregnancy. But in fact, these exercises are incredibly beneficial for men, especially after age 60. Kegels strengthen the pelvic floor, the muscles that control your bladder and urine flow. I've guided many patients through Kegels, and after just a few weeks, they notice stronger urine flow, less leakage, and more confidence. It's easy to do. While urinating, try stopping the stream mid-flow. Those are the muscles to train. Later, practice squeezing and holding them 10 to 15 times a day for 5 seconds each. With consistency, you'll feel the difference. 4. Nutrition, natural medicine from your kitchen. Food also plays a vital role. There are familiar ingredients that support prostate health. Tomatoes, rich in lycopene, a powerful antioxidant for prostate protection. Soy and soy products, high in isoflavones, beneficial for male hormones. Fatty fish, salmon, sardines contain omega-3s that reduce inflammation and support heart health. Pumpkin seeds, loaded with zinc, a key mineral for prostate function. Instead of relying on expensive supplements, start with the meals on your table. 5. A positive mindset, the most powerful medicine. Lastly, let's not overlook the power of mindset. Studies show that chronic stress can worsen urinary symptoms. On the other hand, staying relaxed and optimistic helps the body cope better. One patient once told me, "Doctor, I was terrified when I was diagnosed with an enlarged prostate. But after following your advice, changing my lifestyle, and staying more connected with friends, I realized the condition isn't so scary after all." See, a positive mindset may not cure illness, but can make living with it much easier and more comfortable. To everyone watching this video, I'd love to hear from you. Have you ever experienced symptoms like frequent nighttime urination or weak urine flow? Have you made any lifestyle changes that helped? Share your story in the comments below. I'll read them all and respond to your questions. And if you found this advice helpful, don't forget to hit the like button so more people can benefit too. Dear brothers, after all the stories shared today, perhaps each of us sees a bit of ourselves in them. Maybe it's those sleepless nights, waking up multiple times to use the bathroom. Maybe it's the long moments spent standing at the urinal, waiting. Maybe it's the quiet discomfort of not wanting to talk to your wife or children about it. These experiences aren't uncommon. In fact, they're all too familiar. Let me remind you of Mr. Alex and Mr. Bean, men who paid the price for ignoring their symptoms, for letting their condition go too far. And let me also remind you of Mr. Ben, who chose to make a change in time, and as a result, regained restful sleep, lifted spirits, and steady health beside his family. You see, it all comes down to one decision: to ignore or to listen to your body. That one choice can lead to very different outcomes, and only you can make that decision. Health doesn't just happen. It comes from the small choices we make each day. Choosing to drink one less glass of alcohol, to walk a few more steps, to bravely walk into the clinic for a checkup. These small acts, they're the keys to maintaining health in our later years. So, if you're listening to me right now, I sincerely hope you'll take action, starting today. Don't ignore the signs your body is sending you. They could be the very things that save you from long nights of restlessness, sudden pain, and help you hold onto the joy of living strong, independent, and healthy with your loved ones. If you found this message helpful, please hit like. It tells me I'm on the right track. Subscribe to our channel, Senior Vitality Now, because we've got more videos coming, not just about the prostate, but also nutrition, movement, and proven tips to help you stay strong, sharp, and full of life as you age. And finally, let me ask you one question. Out of the 3 stories I shared, Mr. Alex, Mr. Bean, or Mr. Rober, which one feels most like you? Leave a comment below. Who knows? Your story might inspire someone else to take action just in time. Remember, your health is in your own hands. Choose to live well, live joyfully, and live fully every single day.